Just after 10 to 9, let's return to our main story this morning, the fact that the head of the NHS in England has said that patients are going to have to wait longer for some hospital operations. It's what's being called a trade-off, so that improvements can be carried out in other areas of the health service.
Waiting time targets for procedures including knee and hip surgery will be scrapped, and GPs are being asked to cut back on the number of patients they refer to hospital. Let's
find out what that means for all patients, shall we? Let's discuss this with the Chief Executive of the NHS Confederation, Niall Dickson. Morning, Neil. And also Dr Aisha Awan, who's a GP in Manchester. Hi to you. Neil, what does this mean? If you're waiting for a knee operation or something like that at the moment in England, what difference could this potentially mean for you?
Well, it could mean that you have to wait a little longer, and it's worth remembering that 17 years ago people used to have to wait 18 months and longer, not 18 weeks. So enormous progress has been made by our members in the NHS over that period of time.
And now we're going back?
But now we're going a little bit back, and the answer is, of course, there was a lot of money going into the health service in those days. There's much less money going in year after year at the moment, and inevitably I think something has to give. So there's no use the NHS England saying we should be doing this, we should be doing that. They've had to acknowledge that the NHS can't do everything, and I think it was inevitable that some performance target or another was going to have to give, because you can't simply say to people, keep working harder, we're not going to give you the money to do it. The rising demand is really unprecedented, what the service is having to deal with at the moment.
The government, of course, would say there is more money going in, it's just having to do more.
I think the government would acknowledge, and I think NHS England acknowledges, that the health service has gone through a period of austerity. They may say that that's justified alongside all sorts of other public services. But the difference, I think, in the health service is the levels of demand that people are having to deal with, particularly the number of elderly people, we've heard this 101 times, but who are having not just healthy extra life years, but unhealthy life years. And that's, in a sense, what doctors like this are having to deal with on a daily basis.
Now, Aisha, so we're hearing that GPs are now being asked to cut back on the number of patients who get referred on. What will that mean for you in practical terms in your job?
I mean, my patients aren't going to like it, are they? But at the moment, we're not running a national health service. We're running a national illness service. Doctors and nurses are on their back foot trying to deal with this absolutely massive demand, and we're doing reactionary medicine rather than proactive, preventative care, so that people don't turn into patients in the first place. And this vision, why we're discussing this story, is it's come on the back of this document, the 5-year forward view for the NHS, and we're 2 years through that. And the vision is actually that all these people who are going to A&E, that are unnecessarily going to see their GPs, are actually taken care of in the right place, in a timely manner, by the person who's most appropriate to see them. So for example, right now, somebody's playing football, goes into A&E after their game at 6:30 in the evening because they think their GP's closed, and they've gone in, they've walked in, they're not in huge amounts of pain. They shouldn't have gone to A&E. It's an expensive port of care. The future is that that person would actually be able to call up their GP practice, who would say, why don't you come in and see the physio today, who will sort you out.
Sorry, Aisha, but it's part of the problem, people's expectations. We, had the Royal College of Surgeons on earlier saying that actually we're going to have to take more responsibility for our own health and look at people who smoke, people who are perhaps obese, and they're going to have to be told to do something themselves proactively about their health.
Yes, so I think there is an element of that. I think, though, the way in which services have to change, and that is doing more things in the community and changing the way in which those services are delivered, is essentially the way forward. Now, of course, that does mean we are saying to people who are suffering long-term conditions, for example, that they need to manage their own care, and that they're often the expert, more than the doctor, in their own individual care. But I think the big challenge for the health service is how do you move from a system that was really designed in the 20th century for a different set of patients to adapt to this new set of patients who need managing in the community, and doing that while money's still tight and the pressure is still heavy in the hospital sector.
Do you think, Aaron, you're going to have very frank conversations with your patients and say, look, in the past you'd have had this surgery, but you can't have it now because the money that would have been spent on this is going towards A&E and towards cancer diagnosis? Is that a realistic, frank conversation that patients are going to have to get used to hearing?
We have been having frank discussions with our patients for years now.
But that frank about this money is going to that instead?
Well, that won't happen because actually we won't know where that money is going, but we will have to say you're probably going to be waiting for this a bit longer. And actually that's going to put additional strain on general practice because while those people are waiting for operations, those limited GP appointments that we do have will be used by those people coming in because they've got increased amount of pain, they're having more social care problems, which is another area of massive underfunding. But remember, we're in a transformative stage right now. We're trying to shape the NHS for the future, but we're trying to do that alongside the situation where demand is vastly outstripping resources. So it is a difficult time, but we just need to balance those two agendas.
And Neil, is the NHS being reshaped for the future? Is that what's happening?
It is happening. I think we have to be very careful about not raising expectations about how quickly this can happen. What is being demanded in terms of, first of all, organisations have to stop thinking like an organisation and start thinking about a whole system. Divisions which have existed for years between general practice on the one hand and hospitals on the other, they have to be mended, and we have to start redesigning care so that it's actually the patient and how the patient moves through the system. Our system is very fragmented at the moment between local authorities and the NHS, between hospitals and community, between GPs and hospital doctors. These fissures, these breaks in the system need to be mended, and that, to NHS England's credit, that is what they are attempting to do.
And we as patients, I think, probably have higher expectations than we've ever had, just as it's maybe becoming more difficult for you to deliver those.
Absolutely. I mean, patient expectation is something that we do need to manage. But I think it goes back to this. Everybody has a deep love of the NHS, and people do want it to succeed. When I have turned around to patients and said, I'm sorry, you're going to have to wait for this, they actually do understand that. And they, on the whole, will be, OK, fine, we'll cope with this for the time being. But I don't think they want this to be the direction of travel for the next 10, 15, 20 years.
And where does it go from there? Yeah. Thank you both very much indeed. Thanks for coming in.
Now, big tax changes are on the way for car buyers from tomorrow. It's designed to simplify the system